Hello everyone, I am Dr. Anand Baharani, consultant nephrologist at Baharani Kidney Care Center, MD Medicine, DNB Nephrology. Today we have come here to discuss about CKD and hypertension. CKD is chronic kidney disease affecting kidneys for more than 3 months. The epidemiology, we all know in India it is widespread. 16.8% of the population is affected with CKD. Out of this, the major contributor is hypertension and diabetes. There are two kidneys, as we all know. They are all of the size of the fist. The kidneys function of filtration and creating urine and excreting the waste in our body. If the kidneys are not functioning properly, then we will have renal failure, edema, and we will have nausea, vomiting, all the features of renal failure. Who all are affected with hypertension? The patients who are having old age, family history, those patients who are having increased dietary salt, and few of the secondary causes are there like pheochromocytoma, hypertension, PIH. These are the reasons when the patient will have hypertension. How do we diagnose the patient with hypertension? Whenever a patient comes to us, we will measure his blood pressures, supine position and in sitting position. If the patient is having a blood pressure reading of more than 140/90 for 2 sittings, then we will diagnose him as having hypertension. The patients will have a symptom of headache, renal disease like edema. So then we will think that patient is having a disease of hypertension and renal failure together. How do we diagnose a patient if he is having kidney disease? We will check for his GFR and we will check for his urine routine analysis, which will show us proteinuria or albumin excretion. We will also do a 24-hour urine albumin if it is possible. How we will slow the progression of the disease? We will advise dietary modifications, we will advise medications, physical activity, and allowing to relieve the stress. Dietary modifications, we will advise a DASH diet, which is low in sodium, which is fat-free, rich in nutrients, protein, less fatty meals, and decrease in the carbohydrates. That is what we will advise to the patient. We will advise the patient to have a exercise of about 150 minutes per week with the aerobic activity included. The person will have exertion of his heart and which will reduce his cardiac contractility, decrease his cardiac stress. Medications which we can use for reducing the blood pressures are ACE inhibitors, ARBs, beta blockers, diuretics, and calcium channel blockers. How we can reduce the stress is by we can ask the patient meditation and yoga. Ultimately, I would like to ask how all you will manage a patient with hypertension. Other than this, patient who comes with us, I would like to suggest they go for a proper diet, proper lifestyle modification, go for regular health checkups, keep their blood pressures, regular self-monitoring of blood pressures, and if the patient is having any renal failure, he should consult a nephrologist and go on ahead with his examination and treatment. Thank you.